This is Jerry Hesch from the Hesch Institute. I practice manual therapy part-time in Henderson, Nevada, which is close to Las Vegas, Nevada. Work at the Hesch Institute, and that's our website on the top. H-E-S like Sam, C-H, institute.com. This is an interesting case. The name of this presentation is Blocked Motion at the O1C1, or the occiput/atlas joint, which is reflexively restricted from a rib joint fixation on the opposite side. This is a friend of mine who has been kind enough to let me do some filming, and I'm going to keep his name and face off the film. Basically, he has noted some dizziness when he looks up and some discomfort in the upper cervical spine. And so he came to see me today, and I screened his entire body, and the last thing I screened was his neck, and I missed a subtle fixation which was in his rib cage because I had to go back and look one more time, because I never treat the upper cervical spine until I know for sure that I'm not missing a restriction somewhere else, and finally did find a restriction. And I think that would be very improper for me to treat the upper cervical spine first, even though that's where he hurts, because it is it is a location in the body where the body will reflexively cause a counter rotation if you have a rotation in the lower body anywhere below that level in the opposite direction. Now, the Occipitoatlantal joint is the joint where the occiput, the back of the head, joins the first vertebrae in the neck. Okay, so this is the back of the head, the occiput, and the occipitoatlantal joint. A little tough to see here. Okay, we're just not going to do justice with it. There's a big anatomy model that I should invest in. Here you see a little bit of that joint. Okay, but basically, the shape of that joint is like two cupped hands. So you can see my cupped hand here, and here is the joint. This is the atlas, and it's like a cupped hand that points inward. And of course there's one on each side, and that allows some very, very unique attributes of that joint. One thing that happens at that joint is when you have a rotation of that joint, of the occiput, in one direction, it will side bend in the opposite direction. The restriction that I found with Don is one that I encountered when he was lying on his back. I started testing his feet and ankles and working, screening hip, pelvis, spine, T-spine, and when he was lying on his back, I slowed it down, I tested rib by rib, and when I was on the left side of his body and I pushed medially, I encountered a restriction. So rather than show you on the anatomical model, I think I'm going to have him lie on his back, and I will show you the test that helped me encounter that. So head will go up at the other end, Don, just like before, and you're going to lie on your back looking up. And so there's his belt buckle, there's his belly button, so he's laying on his back, and there's my messy desk. And I came along the rib cage and I was testing medial mobility. And right here, this single rib does not yield. When I come right below it, that rib yields freely. I come back on that restricted rib, it does not yield. I come to the one above, and that yields. Now I can test superior mobility, which is called bucket handle mobility, and it yields nicely. So it's not a bucket handle dysfunction. Go ahead and lie on your right side, please. I still want to test the bucket handle mobility to orient. He's now on his side. There's belly button, there's his waistline, and so there's the rib cage. And I'm going to test above that segment, and I'm imparting a superior spring on the lateralmost part of his rib cage. And I get a hint that the motion is not completely normal there, but I can still create motion there. So it means that it's probably restricted in a different direction. Okay, so go ahead and line your stomach. And you want to put your glasses up and then just put both hands in the very same position. And now he's lying on his stomach. So there's belt line. And you're going to have a hard time seeing this with the camera, unfortunately. But I'm going to do the best that I can. So he's lying on his stomach. And what I found was a prominent rib right here. And when I try and spring it, it doesn't give. But all of the other ribs, I can push them till there's a natural stop called taking up the slack, and I can spring and give an additional movement. But right here, that critter is completely stuck, and the one above it moves nicely. Okay, as do all the rest of the body. And the manner in which I isolated his occiput was I blocked motion at the upper two vertebrae in the neck, and then I did a small twist of the head, and the head would rotate to the right, but it would not rotate to the, I'm sorry, I had that backwards. It would rotate to the left, but it would not rotate to the right. And I'm not going to show that, that technique. I think what I'll do is show it on the skeleton. So just stay as you are, please. And I'm going to lay the skeleton on you here. What I did was I scoot my fingers underneath the neck, and I found the occiput, which is a curved bone, the head, and I came underneath the occiput, and I blocked the vertebrae here. Okay, so I was blocking 1, 2, and 3, and maybe 4 as well. And then I captured his head. Okay. And then I attempted to rotate the head to the left. And so the only joint that would move would be the Occipitoatlantal joint. And it only moves, less than 10 degrees, typically about 3 to 5 degrees. Then I did the opposite thing. I crossed over and I blocked the vertebrae on the other side. And then I attempted to rotate the head to the right, and it absolutely would not rotate. And the same can be said also of testing side bending. To the left was stuck because that joint is stuck in right side bending. Okay, right side bending and left rotation. So it's a very important concept that is not always appreciated in the various types of manual therapy. There's a basic rule that I follow, and that is that if there's a rotation to the left, there's going to be a counter rotation somewhere else in the body, and that applies for chronic conditions, something that's older than, say, a couple of days. And it's very important to treat the foundation of the injury, the bottom segment that's causing a reflex compensation somewhere else. I'm going to stop filming here. We're going to treat the rib, and then we'll come back and I'll show you how the rib is freed up, and I'll retest the occipital joint as well. Don, could you lie on your back, please? I'm going to see if I can capture your head, and if I can show them how I do the occipital motion testing. I think it's just too difficult, so I'll stop filming right here.